Hi, this is Dr. Janowski for Sonata Aesthetics. Today we're going to do what we might call full facial rejuvenation with fillers. And the term full facial really just depends on how far you want to take it. There's many areas that you can inject with fillers, of course. And we're going to inject probably about 4 or 5 areas today, which is quite a lot. And there's no real limit on how many areas you can do at one time. It's whatever the patient needs. And you certainly can do it over a series of treatments if you want. We're going to use the Restylane family of products. We'll use different products for different areas, and I'll describe that as I'm going. And whenever possible, we're going to use a cannula, and sometimes we'll use a needle, depends on what depth we're at. But by doing so many areas, we really get a nice rejuvenation effect, an immediate effect. It should still look natural even right off the table when we're finished. So I'll show you as we're going along. So I'm going to numb up my entry points, particularly for my cannula areas, and for any area that we're going to use a needle, we'll just use numbing cream, but I'm using 1% lidocaine in the small 0.5 insulin syringes, and we're just going to place them strategically so we can reach our areas with a cannula. So I use my vibration tool. We're going to put one at the base of the temple. She has some volume loss in the preauricular area, so we're going to start at the base of that. We're going to do the nasolabial folds here. And then we're going to do a little bit in the under eye, so we'll put some there. Okay, so now that we have our entry points, we use a little lido with epi so we can see a little blanching and we know that where the spot is. I'm going to use my Dermasculpt 1.5 inch 25 gauge cannula, and for the temples I like to stay superficial. There is more than one way to do a temple. You can do deep or superficial. Let's stop the video. So I like to stay superficial and just place it in the subcutaneous area above the temporalis fascia, and we're just going to lay down some threads and fan it across the temple. And the patient will hear some weird sounds, but it's not difficult. And it's okay if it looks lumpy bumpy, that will go away. And by using the cannula, of course, we're avoiding the vessels, avoiding puncturing the vessels here. And sometimes it requires a little bit of force to push through the connective tissue. So once we have it in there, we can do a good amount of massaging because it will look a little bumpy at first. And I always tell the patient it will remain bumpy for a day or two, and they're welcome to press on it at home if they want. Okay, so now we're going to do a little bit in the tear trough, and so we've created our numb point. We can see the blanching there. Again, same cannula. I always use a cannula here. For the temple, I use Define. For the under eye, I like Restylane. And so we're just going to take a little bit and just lay down just a small amount. She really doesn't need that much. Let's have you open your eyes and look at my finger. Let's keep your eyes there. I like to often have the eyes open because that will show the crease a little bit better than if the eyes are closed. So patients usually have no issue with that. I was at probably a medium depth there. I was probably over the muscle because it was a small amount. You can go either under the muscle or over. I usually do a combination, but in this case, mostly superficial there. Okay, so now we're going to use Restylane Lift in the preauricular area. That's the area below the zygoma where people tend to get hollow. And it looks very nice to fill that. So we're going to start from the bottom. And again, I'm going to use a cannula. Whenever I'm under the skin, generally it will be a cannula. It allows for smooth deposition of the product. We're going to be superficial here. Less bruising and often less pain to the patient, especially if we numb our entry point. And we're just going to fan it around and volumize that shadow. There we go. So once again, I can do some massaging and we can see some improvement there.
Okay.
So once again, we've got Restylane Lift, and now that we've done 3 areas, we've done the temple, the preauricular, and a little bit in the tear trough, we're going to do the nasolabial fold. I've created my port already. And again, I like to use cannula here whenever possible. As long as there are not superficial lines that I have to fill here, then I can typically get away with a cannula. I think I'm just going to put a half of that. Okay.
I'm going to show both sides.
Here's the other side. And we're just going to use our cannula technique, retrograde injection, using my left hand to feel where the tip is. Good. Okay, so we're going to use the other half of the Restylane syringe that we used in the under eye. You can see this is a half a syringe, but it looks like a full syringe, and that's because I dilute pretty much all my fillers 1-to-1 with saline. And the reason I do that is, number one, it provides more injectable volume. It also prehydrates the product so there's less swelling, and it's easier to push. So for all those reasons, I prefer a 1-to-1 mixing of the product. And so we're going to use a cannula in the lip. Not everybody does cannula in the lip. I think there's a lot of advantages to it. It's easier for the patient. And it also just allows me to glide in there and create volume. So we're going to do just a little bit in the lip here. We're going to divide it into 4 quadrants, and we're injecting from the commissure, and we're getting right under the mucosa of the lip, using my left hand to guide where the product is going, just like that. And then it just makes for a fairly simple, fairly quick, easy lip injection. And so I make sure the tip is right at about the GK point there. And then we can slip underneath the mucosa quite easily with the cannula with guidance from the left hand. If you need significant amount of shaping, this is not going to be the best method, but if you just want to get some volume in there, most of the time it works just as well as a needle without the bruising, without the multiple needle pokes. And we can just feel the product. Of course, you can use many different products in the lip. We use often Restylane Kiss and Restylane Lift. In this case, it's just Restylane. They all work pretty well. Okay, so our final area is the Marionette line. For this area, I find it works better to use a needle. In this case, we're using Restylane Lift, mixed 1-to-1 with a 30 gauge needle. Again, other products you could use Define here. I'd like something firm to provide support, and I find that some of this injection is very superficial, so it's hard to do as well with a cannula. So this is one of my needle areas. We've already used numbing cream here. So we want to provide support to the commissure in the corner of the mouth. And so I'm just using small amounts to do a serial puncture technique. And as you can see, I enter the skin very quickly. That reduces the amount of pain that the patient's going to feel. And you can also use techniques with your left hand, such as pinching, vibration, tapping. There's lots of different things that the left hand can do to reduce pain as well. And in this case here, I'm just going to slip slightly subcutaneous and provide support in the Marionette. Okay, good. Okay, so we just did full facial rejuvenation in 6 zones here. We did the temple, we did the preauricular, we did the under eye, tear trough, the nasolabial fold, the Marionette, and the lip. And so there's lots you can do in one session. And as you can see, it doesn't look overdone. There's really very little in terms of healing, swelling, recovery. There was very little bleeding because we numbed those entry points and we used a cannula for most of it. If the patient wants, you can use arnica or ice. I generally don't recommend icing the lip because of the swelling, and any of the other areas are okay. And again, if there are other areas you want to add, you can always bring the patient back to do more. So that's full facial rejuvenation with fillers.